Before we begin, I want you to pause for a moment and think about something very simple. Think about the medicines you took today. The ones your doctor prescribed, the ones you trust, the ones sitting in your medicine cabinet right now. Because for many older adults, those medicines bring relief. They reduce pain, they control blood pressure, they calm symptoms that make daily life difficult. And for many people, those medicines truly are helpful and necessary. They allow movement, comfort, and stability. They allow people to live more freely than they otherwise could. But there is something many people are not told clearly enough. Some medications, especially when used over long periods in older adults, can place extra strain on the heart in ways that are not obvious at the beginning. And the difficult part is this: you may not feel anything at first. In fact, you may feel better. You may feel like the medicine is helping, and in many cases, it is helping. But at the same time, something deeper may be slowly changing inside the body. Hello everyone, welcome back to Senior Health with Dr. Sarah Mitchell. Today, we are going to talk about something that can feel uncomfortable, but is very important to understand. Not to create fear, not to replace your doctor, but to help you see the full picture more clearly. Because this is where many people get the wrong idea. They believe that if a medication is prescribed, it must be completely safe in all situations, for all ages, for all durations. But medicine does not work that way. Every treatment has benefits, and every treatment also has limits and possible effects that can change over time. And after the age of 60, the balance between those can slowly shift. Let me explain this through a situation that reflects what many families have experienced. A man in his early 70s had lived a healthy and active life. He had some knee pain from arthritis, nothing unusual for his age. His doctor prescribed a common pain medication to help him move more comfortably, and it worked. His pain improved. He could walk more easily. He felt more independent again, so naturally, he continued taking it. Day after day, month after month, year after year, the medicine became part of his routine. He believed he was doing the right thing, and in many ways he was. He was following advice, managing pain, staying active. But slowly, something else was happening in the background. At first, it was small. He began to feel slightly more tired. Climbing a gentle slope felt harder than before. At night, he noticed he could not lie flat as comfortably as he used to. He ignored it at first. Like many people, he thought it was just aging. But over time, those small changes became more noticeable. And eventually, they led to something more serious. His heart was no longer working as efficiently as before. Now I want to be very clear here. This does not mean the medication suddenly damaged his heart in a dramatic way. That kind of thinking is not helpful and not accurate. What it does mean is that certain medications, especially some long-term pain relievers, can cause the body to retain fluid, slightly increase blood pressure, and place extra workload on the heart over time. In a younger body, the heart often has enough reserve to handle that extra work. But after the age of 60 or 70, that reserve becomes smaller. The heart is still strong, but it is not as forgiving as it once was. So even a moderate increase in workload, when it continues for years, can gradually change how the heart functions. Not overnight, not suddenly, but slowly. This is where many people miss the real story. They look for a sudden cause, but the real change often happens through a long, quiet buildup. This is where many people misunderstand what is happening. They see improved numbers and assume everything is improving equally inside the body. But sometimes, one part improves while another part needs monitoring. This does not mean the treatment is wrong. It means the situation is more complex than a single number. Now let us look at a third situation. A man in his mid-70s had been dealing with long-term acid reflux. His doctor prescribed medication to reduce stomach acid. It worked quickly, and his symptoms improved, so he stayed on it. Not for weeks, but for years. This is very common, but what many people do not realize is that long-term use of certain acid-reducing medications can affect how the body absorbs important nutrients. One of these is magnesium, and magnesium plays a key role in maintaining normal heart rhythm. When magnesium levels drop slowly over time, it can increase the risk of irregular heart rhythms. Not suddenly, not in every person, but gradually, and often without clear early warning signs. Now I want you to notice something important. These three situations are different. Different people, different conditions, different medications, but they share one pattern. The issue is not always the medicine itself. The issue is long-term use, changing body conditions, lack of regular reassessment, and the assumption that safe once means safe forever. This is where many people get the wrong idea. They think a treatment that worked safely at 60 will behave the same way at 70 or 75. But the body changes, the heart changes, the kidneys change, the way medicines are processed changes, and that is why review matters. This is the point where many people start to feel uncertain. They begin to wonder what they should do, and this is where it is very important to stay grounded. Do not panic. Do not stop medication suddenly. Do not replace medical advice with guesswork. Instead, take a smarter approach. At your next appointment, ask better questions. Ask whether the same dose is still right for your current age. Ask whether there are safer alternatives now. Ask whether your heart function, kidney function, or electrolyte levels should be reviewed. Ask whether the treatment plan is still right for you today, not just the version of you from several years ago. Because medicine should not stay frozen. Your body changes, your needs change, your risk changes, and your treatment should evolve with that. Now let us step back and look at the bigger picture. After the age of 60, the goal is not just to treat a number or a symptom. The goal is to protect the whole system. Your heart, your circulation, your energy, your independence. That requires balance, not fear, not blind trust, but informed awareness. If you are taking medications, that does not mean something is wrong. It means you are managing your health, but managing health also means reviewing it over time, making sure what helped before is still helping now. And if there is one thing to remember, it is this. Do not assume that working always means safe long-term. Ask questions, stay involved, understand your treatment, because your health is not just about what you take, it is about how your body responds over time. Thank you so much for watching Senior Health with Dr. Sarah Mitchell. If this video helped you understand your health in a clearer way, please like, subscribe, and turn on the bell so you do not miss future videos. This video is for educational purposes only and does not replace medical advice. Always speak with your doctor before making any changes to your medications or health routine. Please take care, stay safe, and I wish you better health and peace in the days ahead.